The way that this webinar is set up today is in two sections. The first one is where I will go through online data sources for you, and then the second section will go through some gaps in the data, or at least data that are a little bit more challenging to release due to small numbers. So we'd like to get started. The first thing that we'd like to do is to ask you all to answer just a question about how often you look online for cancer data, just so that I can kind of get a feel for how familiar you all are with what's out there.
You want me to go ahead and broadcast this, Michele?
Sure. Okay, so it looks, oops, still some coming in. Okay, so, and then is this something, Sarah, that everybody can see then, the results?
Yes.
Okay.
Yes, everybody should be able to
Okay,
right
so
now.
there are a lot of you out there that are looking up data every week, so that's good to know. Okay. All right.
Hello?
Yes? Okay. All right. The first group of data statements that I want to address are those that deal with mortality. So I will often get people who want to be able to answer if cancer is the second leading cause of death, or if it's the first leading cause of death, or people that want to be able to address leading cause of cancer in, say, females or males. And the best source that I've found for that is to go to the Iowa Department of Public Health. I have the website listed there for you on the slides. It's a great source for all mortality data, including cancer. It also gives cause of death by gender or particular age group. Okay, so in this particular instance, I'm not going to actually go to the website, but I wanted to list some of the figures and the tables that I use the most, and these are those that are related to cancer. So they have a figure 18, which gives cancer deaths by age and gender, and they give percentages, which I'll show you in a minute. They also have a couple of tables that give cause of death information by number and gender, as well as the top 10 causes of death in females or males, and it will give it for the last 3 years. So that way you can look to see if there's been any changes. Okay, so this is figure 18 from the Iowa Department of Public Health, and as you can see from the title, it's malignant neoplasm deaths by age and gender with the percent distribution. So we often talk about cancer being a disease that occurs most frequently in those 65 and older. So if you needed to present any data with a certain percentage involved, you could go to this graph and you could actually add up and see that you might have roughly 75% from 65 and older. Or if you needed to address the younger population, you can add up the percentages. And it's given there both by male and female as well. Okay, and then the next one that I wanted to show you is Table 17, and this gives the leading causes of death by number and the percent of the total deaths, and this is for 2010. I particularly like this one because we have been kind of watching the numbers of cancer deaths versus heart disease deaths in the last couple of years. We actually had cancer overtake heart disease in 1 year, but now it's been back to where heart disease is the number one cause. So this is a great place to go to look for the numbers, and you can see there in 2010 that we had 6,859 heart disease deaths, whereas we have 6,346 for malignant neoplasms. And you can see that the number is pretty close there in males, and it's a little farther apart in females. Okay, and I have a question that came up on the chat that wants to know by whom this data is collected, and this is actually collected through the Iowa Department of Public Health, who then has to send the data in, so you would get this with like the National Cancer Statistics, but they are the one who collects all of the death information for the state. So if we have people who request cause of death information, we need to get the release from the Iowa Department of Public Health for us to actually release this information to researchers or to anyone who might want the information. Okay. Last one I wanted to show you, this one actually breaks down the number of deaths in the females by the 10 leading sites. So if you needed to put into a publication or something what the leading cause of death were, you could look and see that lung cancer is the number one cause of death in females, followed by breast, and then it goes through and lists pancreas, ovary, that sort of thing. And you can actually look, they do give it by white, African American, and other, and they give it for 3 years, so you can look and see if there's been any changes over the last couple of years. Okay. All right, then the next section that I wanted to discuss would be some screening data. Oftentimes people look to Healthy Iowans 2010, and we can actually look to see what goals were listed there and to see if we've reached them. So I have a question here for the poll, would be to ask if Iowa has reached the Healthy Iowans 2010 goal of having 55% of people having had a fecal occult blood test in the past 2 years. So go ahead and write in if you think that we've reached that goal or not. Okay, Sarah, if you want to broadcast them. Okay, so we have almost 90% of you saying that no, we haven't reached it, and 10% saying yes. So let me go ahead and show you where I would actually go for the screening data is, again, the Iowa Department of Public Health, but this time we're going to the BRFSS data, which stands for Behavioral Risk Factor Surveillance System. The BRFSS is an ongoing telephone survey designed to collect information on health conditions, risk behaviors and attitudes, and awareness in residents who are 18 years of age and older. The main goal of this is to try to determine the prevalence of personal health behaviors relating to the leading causes of premature death. So it's done by random digit dialing. So it's been a little bit more difficult over the last few years when people are not using their landline telephones as much and are all on cell phones, but they've still been able to collect the data. This is what the publication looks like. They do this every year, so it'll have the date on the cover so that you know which one it is. And the one thing that I wanted to show with the table of contents is that the questions that are asked in the BRFSS change on a yearly basis. Some content stays the same, but there are some things that change. So for instance, my question had to do with the fecal occult blood test. So the first thing that you would have to do is to go into the table of contents and make sure that you can scroll down and find information on colorectal cancer screening. So in this particular year, it's listed there with the number 14. And if you don't find it then in like 2010, then what you would have to do is go to the 2009 publication and check to see if it's listed there. Okay. So then what you would do there is you can go to table 14.1, which talks about the prevalence of the colorectal cancer screenings. And this is for Iowans who are 50 years of age and older in 2010. And my question dealt with having had a blood stool test in the past 2 years. So you can see the total is across the top. And if you go to the one that says had blood stool test in the past 2 years, you see that the percent is 17.4%. So in my question that I had asked, the Healthy Iowans 2010 goal was for 55% having had a fecal occult blood test in the past year. So we obviously have a long way to go, sitting there at 17.4. So those of you who had guessed that we had not reached it are correct. Okay. The next area that I wanted to go through, I get a lot of people who call me asking for projected number of cancers that we would expect to see in the current calendar year. This would be a good place to state that at the registry, we have our 20 field staff who are out collecting information throughout the state, but there is a lag time. So we submit data to the National Cancer Institute every November, and so our 2010 data just went in. So There are lots of instances when we want to know a little bit more recent data, so that's why we put out our Cancer in Iowa publication, and we then include in there estimates for 2012. So I will get a lot of calls for people who want to know the number that we expect for a particular county, and that can be either new cases or the number of cancer deaths that we expect to see. And then I also like to compare how their cancer experience is in, say, their county, and then compare it to the counties around them, or they want to compare it to the state overall. And so we can actually look in our publications and in our data to figure those out. But before we go to the website, I think, Sarah, did we have a poll that we wanted to?
We did, but I've lost my internet connection, so I can't bring it up unless Rachel can bring it up. Otherwise, we'll have to move on.
Okay.
Sorry.
That's fine. Rachel, do you know if it's there, or should I just go ahead and move on?
I'm going to try to find it here.
There we go.
The right one?
Okay. Yep. Thank you, Rachel. Okay, go ahead and answer. I just have a question out there for how many cancers do we expect to see in Iowa for diagnosis year 2012? Do you think it's 15,500, 17,500, or 20,500? And there you had to open it. Yep, there you go.
And Sarah, do I just click close?
Nope. So I think, okay, and it looks like everybody's had a chance to finish. So we have about 70% of the people guessing 17,500. So hang on to that number in your head for a minute here, and let me take you to our website.
Now you can close it, Rachel.
Yep. Okay. So the one website that I am going to actually go to directly is the State Health Registry of Iowa. The website there is listed for you. We have population-based cancer data for the state of Iowa that goes back to 1973. We have data now through 2009. Once the 2010 data gets cleaned up with NCI, they will go ahead and post it in like their SEER-STAT, and then we will actually be able to update our data on our website through 2010. But as of right now, our most recent year is 2009. We also have county-level maps that are available. We have data trends that you can look at over time. As I mentioned before, we have the projections for the year 2012 as well as publications. Okay, this is a screenshot of the State Health Registry. Just wanted to give you that. And then, okay, so then, Sarah, is Rachel going to go ahead and bring up? Or
do you have another poll, Michele?
No, so we're going to actually go to the...
Can you make me the presenter or host again, Rachel, so I can do it? Sorry, I apologize for my internet connection went out.
Otherwise, I can try it
Perfect.
from mine.
Yep, I can do it right.
Okay.
Yeah. Just, might take me 2 seconds.
Oh, that's fine. But I'll just go ahead and talk while we have a chance. So we do have like 20 people that are out. They have their own territories that they cover. We're into the hospitals, path labs, freestanding, like oncology clinics. And we're trying, obviously, to get 100% coverage for every Iowa resident that is diagnosed with cancer. As the data comes in and stuff, it gets cleaned up in that. And in the last few years, we now have our own website, which has a great tool out there called Iowa Cancer Data. And it has greatly cut down on the calls that I receive from people that used to call in to get data, because now the website is pretty easy to use. People are able to go there and to find the particular number that they were interested in. And so it's really helpful that it's quick. They're able to get the information that they're needed into their program planning even on the same day. So I just wanted to go through with you our website just to kind of show you what's all available. I'm going to go through. Is that Rachel?
Yep, and I brought it up. Can you see it?
Yep, it's fine.
Control. Okay.
And then, okay, yep. So let me request control. Okay, thank you. Okay, so this is the home page, and you can see I'm going to go ahead and click on publications. And this is our most recent publication is the Cancer in Iowa 2012. And I just want to show you that even in there, hopefully it's working. My screen just went purple.
I was going to say, it's up on my screen.
The download,
the document.
Let me, oh. Okay, so that's interesting. I'm not seeing anything on my screen except purple.
Okay, let me bring it back to the website then, I think.
Okay, so, okay, well maybe if it won't work to download that, let's just go ahead and I'll go to the Iowa Cancer Data tab. Okay, and everybody can see that okay? I hope. Okay. So what we have over here is a map. So once you go to the right-hand side and click on the information that you want, it'll generate a map for you. The first thing that you will want to do is to go to the data source. It's now set up for invasive cancer incidence, so I will go ahead and leave it at that. The geography is always at the county level, and then you can go in and you can pick your cancer site. So you can either do all sites, or you can scroll down, and let's say that we were interested in colon and rectum. You can click on that. You can do in 5-year time periods, which is what it's set up at, which is fine so that you can make sure you have plenty of numbers. You can do both sexes combined, or if you click on it, it would let you click on either male or female, but for now, I'll go ahead and do both. Race, ethnicity, you can either do all, or right now it's currently just set up to do white and black, so let's leave it on all. The standard population you don't need to change. That'll stay there. And the confidence intervals for right now I'll leave off, but I'll show you what you use those for in just a minute. So once you go through and fill in each of these different tabs, then you click the redraw button. And you'll see now how it brings up the map to the left. And what this does is it separates them out by colors for quartiles. So in this particular case, the lightest color will be those counties that are in the lowest quartile, and then as the colors get darker, the rate gets higher. So this is the age-adjusted invasive cancer incidence rate for colon and rectum cancer for the period 2005 through 2009. So you can see it visually there with a map, or you can see down below where it actually gives the county names, what their population were. You'll see the cases and the crude rate, which is just determined by taking the number of cases and divide by the population at risk. And then it gives you the age-adjusted rate, which if you want to actually be able to compare a particular county to another county, you need to make sure that your rate is age-adjusted because that accounts for the age of the particular county. So if you lived in a county that had a higher percentage of elderly patients, your rate would be expected to be higher since cancer is a disease of the elderly. So without doing an adjustment, you wouldn't be able to make comparisons because there could just be differences in the populations in the particular counties. So this allows us to be able to make comparisons. And the way that these are presented is by the age-adjusted rate. So it'll start with the highest county, and then it'll scroll down all the way. And then at the very end, you'll see the state rate is given there as well. Okay. And then you can also go over to the map, and you can actually click on a county. I happen to click on Jasper, so then it'll bring up Jasper County down below. It'll give each of the individual years from that time period that we were looking at, and again, give you your population, your total cases, your crude rate, your age-adjusted rate, and then the statewide rate as well.
In all the times I've used this, Michelle, I never knew that.
Really? That you could click on the...
So I learned something today.
There you go. Well, and sometimes, people are like, now where's my county? But at least if you hold it on there, it'll actually bring up the name of the county. So if you're off by one, you can go, oops, I'm right over here. Okay, so now it's oftentimes important to be able to state whether or not the rate that you have for a particular county is statistically different than another county that you're interested in. And that is why these confidence intervals up here become important. So let's just say that we were interested in the same query that we did before, but this time we want to make sure that we turn the confidence intervals to on. And then always remember that when you change something, you need to click the redraw. And then the change is down here in the table. After the age-adjusted rate, you will see the 95% confidence interval. So it's going to give a lower limit and an upper limit. And what you do, say that you happen to just be interested in Osceola and Page counties. So if you were to put like 57.26 on a number line and say you were going to shade in all the way to the right until you had 119.07, then what you do is you take the next confidence interval, which is 59.85 to 94.27, and if you were to shade that in, you would see that they overlap, that the 59 to the 94 is contained in the one that was larger from 57 to 119.07. So since they overlap, you would say that there is not a statistically significant difference in those two counties. But now let's scroll towards the bottom, and I'll give you an example. So let's say Madison County down there, which happens to be the lowest rate, has an interval of 25.5 to 54.35. So if you go back up, you see that like Osceola doesn't start until 57.26. So if you were to draw those two, you would see that the first one ends at 54, and this Osceola doesn't start until 57, so you would have a gap. So then you would say that they're statistically significant in that Osceola would be statistically significantly higher in its incident rate of colon or rectum cancer compared to, I think it was Madison County, which was at the end. So that's how you use the confidence intervals. Okay, then I wanted to go up and show that you can, like let's go back to putting in all sites. And if you wanted to just get like 1 year's worth of data, instead of clicking on 2005, you can click on 2009, and then you can go ahead and hit redraw, and it'll just change and stuff. The one thing that you have to be careful in is that sometimes the particular cancer site that you've selected, there may not be enough cases in one particular year. So then when you scroll down into the table, they may give you warnings that like rates are unstable if there's less than like 10 in a particular grouping. I picked all sites, so I can show you what that looks like if you pick something where you don't have very many. So see, in this particular case, it's so rare that the table has lots of empty spaces. And then you would just need to know that you would have to go up and add in another couple more years until you actually get enough cases to do something with. Okay, and then say that you wanted to do mortality data, you would just go up into your data source and click on cancer mortality. Say you wanted to do, let's do something specific. Let's do like prostate. And you kind of just have to, you'll get a little bit familiar with how it's set up, but you just kind of have to scroll through and find the particular site that you're interested in. Let's go back to doing 2005 through 2009. This time it automatically selects males for you, and then go ahead and click the redraw. And again, it's set up, it's just the shading now for the mortality data is in blue, but again, it's set up in the quartiles. And the data that you see in the bottom is set up similarly in that it'll start with the county that has the highest mortality rate. Again, it gives you the population. This time it'll give you the number of deaths, the crude rate, and again, the age-adjusted rate. And then this time I wanted to go through these buttons here because they are also very helpful. If you click on the state data, it'll just kind of knock you out of giving you the information by county, and it'll just give it to you for the state from 2005 through 2009. This one is age-specific rates. I don't really necessarily use that one too much, but if you, for some reason, had a specific age group that you're interested in, you could actually find the age-specific rates there. Then if you just click on the back button, it'll take you back to these. This one is population data. So again, it'll just give you the numbers there from 2005 through 2009. Bar graphs and stuff, I'll show you. I don't use it because it's a little bit overwhelming by the county. My favorite, though, that I wanted to point out, let's say that you are focusing on a particular county and you just went through and calculated the rates for prostate county or for prostate cancer, and then you thought to yourself, okay, I need to do like the top 10 cancer sites, and you think, oh, I wish I didn't have to go back up there and change the cancer site and re-click this every time. Well, you actually don't have to. If you go down here and you remember that you click on this site comparison, and if you actually just click on it, it'll give you, this one happens to be the state profile, but it'll give you for all of the cancer sites so that you don't have to go back and re-click on each one. It's a great tool. The one thing is that it comes from the state cancer profiles. So if you click on that button, it's always going to give you the data for 2005 through 2009. So if you happen to be looking at just a single year's worth of data, it doesn't work for that, but it will give you the 5-year time period, which is really slick. And if you let's just say that you were clicked on a particular county. So say you were in Hamilton County and you had just looked at the prostate cancer, but if you click on it, then it'll actually give you information then on the different sites. And again, this is mortality, so the numbers are pretty small, but if you were in doing the incidence data, again, it's a wonderful tool, so you can have it all at one click and you don't have to redo everything again. This button here is just for downloading, and this is for printing. And then if you need help and stuff, they have the help session there that you can click on. But I think, if you just spend, even an hour on our website and just play around with this, I think it's pretty easy to figure out how to use it and get the information that you need. So we're quite happy that it's out there. It makes things a lot easier for everybody than to try to contact me or Dr. Lynch or something for data. Okay. All right, with that, I think then we can go back to the presentation. Okay. So I have to release control, I think, then, maybe?
Or I think I can stick it this.
Okay. Okay. Unfortunately, I couldn't get the publication to show up on my end, but if you clicked on our webpage where it said the publications, you can click on the 2012 publication. I just wanted to show you that that's one particular place where you can see if you go to the new cancers in females, the total there is 8,500. And if you go to the total of the new cancers in males at 9,000, if you added those up, it gives you the total of 17,500, which is what the majority of people out there were guessing. So good job, everybody. And it's also there's some text in the beginning of our publication, too, that just talks about what we expect to see for 2012, and we list the number of deaths and the number of new cases projected as well. Okay. And now that we've kind of gone through the Iowa data, I also have people that ask, is there a place that has site-specific cancer data, such as the numbers of the new cases and the deaths that we just gone through, like for Iowa, and where you can get risk factor information, survival rates for other states other than Iowa? And I just was wondering if you guys know of any places, if you have used sources where you go for other state information, you can go ahead and type in your answers there.
While people are typing in their answers, Kelly posted a question about the State Health Registry's annual report and that she has a hard copy. How would someone get a hard copy?
Oh, okay. On our website, we have, I forget how it's set up, like a query. One of the little buttons is that it takes you to where you can email us, and you can just ask us that you would like to have a hard copy and just put your name and your address in there, and those queries get routed to me, and I can get one in the mail to you.
And then it looks like, can everyone see the results, then I believe, of where people get their data?
Okay. All right, so we've got CDC, Cancer Planet, KFF, and the Centers for Disease Control. Okay. All right, well, let me show you. Um, um, I wanted to bring up the Cancer Facts and Figures. This is the national publication for 2012. Um, those of you are probably familiar with how this one looks. I basically just wanted to go through it briefly to give you an idea of the contents that are in there. This is one that comes out, the issue that comes out in January and February has the new estimates for like 2013 or 2014, as the years go on. And it's one that is looked forward to every year, and they have those figures in there of the male and female and stuff, which many people put in all of their publications and that sort of thing. But they also have other selected cancers and stuff that they actually put information on. They have special sections. This one happens to be the cancers with increasing incidence trends from 1999 through 2008. But they also have tobacco use information, cancer disparity information. You can see nutrition and physical activity, environmental cancer risks, and so forth. So it's a nice publication that talks about many different things other than just giving you like trend data and estimates. And so with that one, since that's the national one, I was just interested to see if you guys have seen the new Iowa Cancer Facts figures that just was released this fall.
May I go ahead and broadcast it?
Yep, I would say we're still filling in, but yeah, it's good to see that the majority of you have. Let me go ahead and show you what our cover looks like, and we have the website listed there for you at canceroiowa.org. This is the first time that we've put together the Iowa Cancer Facts and Figures. I have the table of contents put up there so that you can see what all is included. We have a basic fact section on cancer, just basically answering like what is cancer. We have a terrific section on cancer prevention. We picked the topics of tobacco, radon, nutrition, physical activity, and obesity, as well as alcohol, ultraviolet radiation, and vaccinations. We then have a big section on the cancer incidence and mortality data. We have trend data in there, and we talk about cancer as a leading cause of death. And then it's set up on the cancer sites in particular. And so if you go to each of those sections, you'll find additional information on lung, colorectal, breast, prostate, skin melanoma, cervical cancer. So we have like survival data. We have incidence and mortality. We also did some survival information, the cancer survivorship. We put in some cancer disparity information as well as understanding cancer rates. And then we have a glossary of terms and that sort of thing. We would love it if you guys spend some time with the Iowa Facts and Figures and then go through and share your feedback. We have the web address there. The plan is to hopefully put out a Iowa Facts and Figures every 2 years. And so we would love to get the feedback from you guys to see what you liked about it, what maybe you didn't like so much, or what you think might be missing, or just to go ahead and ask us if there are data available on any specific areas of interest. We would love to have the feedback so that we can go through and figure out how we can make the next one even better. And then for those of you who find that there are pieces in there that you may be interested in sharing with others, we are going to have PowerPoint slides from the Iowa Facts and Figures that will be available on the canceroiowa.org website in early 2013. Okay. Alrighty. Let me scroll through some of these things here rather quickly so that we can make sure we have some time for questions at the end. But we find that visual data is very important for people to use out in the communities. I wanted to give you websites for some smooth maps that the Department of Geography have done working with the Consortium. This just gives you an idea of what they look like. Up at the top, you can click on the different cancer site that you might be interested in. And then you will see that they are smooth maps that go through cancer incidence from 2000 through 2005. And there are ones that show late-stage colorectal cancer in this particular instance. So you can kind of see how many cases are being diagnosed, and then you can also see how many of them are being diagnosed at a late stage, so that if you have a high area of late stage cancers, you might want to focus some of your screening emphasis in those particular areas to try to get the cancers diagnosed at an earlier stage. Um, we are just in talks, I know, with the consortium members, and Jerry Rushton from Geography just called me up last week asking me on where we're at with data and what's available. They're now going to try to update these maps with data from 2006 through 2010, and my guess would be that they will be available sometime in 2013. So I just wanted to point that out to you. Okay, and then sometimes there are instances where you need more in-depth data than what you can find like on our website. Say you need particulars in like histology or morphology or by race ethnicity that you can't find. SEERSTAT is a great tool. There is a bit of a learning curve, but this website just shows you where you can actually order to get SEERSTAT. But if you have questions on data that you just can't find anywhere, feel free to contact me. I have SEERSTAT and am familiar with it, and I can usually generate the data for you in a day or two. Okay, and then just wanted to touch briefly on use of data in program planning, going to the Cancer Control Planet. And I know that this website has the data from the state cancer profiles. It actually has the comprehensive cancer control plans and some budgets there, information on collaboration and evaluation. They also have some of the topics that we've been talking about that are in some of the other publications, particular cancer sites, different risk factors available as well. And I know, Sarah, are you able from where you're at then to be able to discuss this just briefly of how
Sure.
you've used it? Okay.
Yep, and I really enjoy Cancer Control Planet, so if anybody's out there who uses data sometimes, but all the time, it's a great kind of one-stop shop to find things. The state cancer profiles you can see is at the top of the page. A new venture from the NCI is the Research to Reality, where they're trying to connect researchers who are studying these topics to people out in the field trying to implement them, so you can check that out. And then the community guide, if you've never visited that site, that's the next link under research synthesis, and that has programs that have been evaluated and found to be evidence-based, so you can find ideas for programs and projects directed at different communities. And then our tips is under programs. That's something else, the research tested intervention programs. Again, it has a wide variety of topic areas, and you can sort by, if you want to target African American churches on healthy eating, you click those categories, and it will give you, again, things that are already evidence-based and proven that you can work with. So this is a great resource. And then, again, like Michele said, down under plan, you can see other states' plans in addition to Iowa's plan, and then budgets that exist for the plan. So the Cancer Control Plan is a great place, and if you have any questions about using it, you can always contact Rachel or myself.
Okay, thank you. All right, the next one that I wanted to go through is the state cancer profiles. As I've showed you before, it gives data for 2005 through 2009 for every state, has trend data, 5-year rate changes, maps, screening risk factor data, census data. This just is what it looks like. You can either go up to the top left and do a quick profile on a particular state and choose a cancer site of interest and generate the profile. Or some of the other things that I know Sarah and myself, as I've been getting a little bit more familiar with this, under the support data, the screening and risk factor information. If you click on there, it's great. It gives you a way to check for particular risk factors. Say you want smoking data, or it's a screening risk factor, mammography use, pap smears, that sort of thing. It's the BRFSS data, so it's another place to get that. If you want to get demographic data, which is the next one underneath there, it'll give you census data for the counties and the states, so that you don't have to go to like census.gov. So it has a lot of handy things on this particular website. I just wanted to show you, I used it. Say that you were in a county in southern Iowa and say you were looking at breast cancer mortality. This generates it, like I said, for 2005 through 2009. You have the state of Iowa. It actually has the Healthy People Objectives there. So this one, it's set up, has Iowa met the Healthy People Objective of 22.3? And we have. and it gives you the annual death rate where we're at of 21.8 and the confidence interval. And if you compare that to Missouri, which is the next one underneath it, it'll say that they have not reached their healthy people objective. They're at 24.9, and it gives their confidence interval. So if you needed to compare Iowa to another state, you just use those, generate the profiles, and you can go and do that for Iowa and Missouri. So I just wanted to point that out. Okay. I just kind of wanted to shift gears a little bit and go through a little on gaps in the Iowa cancer data. So I've talked a little bit about what we have available, whether it's frequencies of new cases or deaths, and you can get the information by age, race, or gender, stage of disease, county or type of cancer. We have incidence and mortality rates available and survival, and we also have mapping capability at the county level. So oftentimes people will call me up and just ask if they can get the number of invasive cancers for like the most recent diagnosis year. And sure, it's not a problem. For 2009, I start off with 16,910 cases. So you think, that's quite a bit to work through. And then if you go through and look at them by particular cancer site, we usually say that 50% of our cases are for the big four: breast, colorectal, lung, and bronchus, and prostate. So you can see that we're at 52%. But 48% left is still over 8,000 cancers, and I'm not sure if you can read them, but I just wanted to show that, there still are lots of cancer sites that we can actually release the information for, usually as long as it's above 5. If somebody's asking for data, I can release any numbers that are bigger than 5. So we're still in good shape. But then they'll say, okay, well, can I get the number of cancers diagnosed in 2009 by race? And normally you would think, well, sure, and I think we have a poll. If Rachel can bring up the one, I just wanted to see.
I don't think we have this one.
Oh, we don't? About the number for African Americans?
Oh, for African, yeah.
Yep. Okay. So normally you think, well, that shouldn't be a big deal. We can go through and do white African Americans and see. But I just wanted you guys to get an idea. How many African Americans do you think were diagnosed in the state of Iowa in 2009? 266, 526, 976, or if you don't think the data is available? Okay. We can go ahead and just broadcast what people think. People are guessing, kind of around the 526, or some saying that it's not available. So if we go back, yep, okay. Do you want to close that? There we go. Okay, so if we get the numbers by race, you can see that we've got over 16,000 still in white, but we dropped to 266 for African Americans, only 27 for American Indian, Alaska Native, 90 Asian or Pacific Islander, and then for the other and unknown. So not very many. And then when people want to have information on particular cancer sites, then at least we're still able to have like 15 sites or so that we're able to release the information on. And that's for the African Americans. But then people will want data by ethnicity. So if they want Hispanic data, we have 162. So it's hard as the numbers get smaller of being able to release this information. And then if you look at sites, then we're down to like a dozen that we have at least greater than 5 on. And then if people are interested in the particular counties, you can see that the numbers that we're able to release get smaller and smaller. Okay, and I've got a chat. Christy wanting to know if it's possible to find data about patients' insurance status. We collect insurance status, but it's probably more of a research question, so you would probably have to get approval to get it released from us. We use it in our annual Patterns of Care study, but it's not anything that's put out for the public use as far as I know. But it is possible. You just have to get permission and then contact myself or Chuck Lynch.
So it's already collected. It just needs to be, you get permission to see it.
Mm-hmm.
Good to know. Good question.
Okay. Alrighty, and then lastly, I'm just going to go through, and I wanted to save a little bit of time for questions. So since our information on health disparity data, our numbers are smaller, obviously the way that you could increase the numbers is to go and have more than 1 year of data put together. So instead of just looking at 2009, you could go through in 2005 through 2009. But these are just some websites that actually have more data available, and I just have them listed there with the website. So it's the National Cancer Institute, the Office of Minority Health, the Centers for Disease Control. I have a couple there, and the American Cancer Society. But I wanted to allow time for questions, or if there's any websites or anything that you wanted us to try to address questions for, feel free to ask.
And everyone can ask questions in the chat box, or you can press *# and unmute your phone and ask them over the phone. And like Michele said, if you have specific questions or if there is a particular website that you want her to kind of do a little run through, we can do that as well. And I do have that poll, Michele, if we want to make them decide which website.
Oh, yeah, I can't even remember what,
Yeah.
what our last poll was. Oh, yeah, just with the choices. Sure, that's fine.
If we don't get other questions, we could do that, or we could.
Right. Well, and I was thinking, too, I don't have my contact information up there, so is this an okay time I can give my phone number or my email, do you think?
Yes. Yep, you can put it in the chat box if you want.
Oh, I could try to see if I... let's see.
Would you mind saying it out loud also? I'm
Sure.
not on the webinar portion.
Oh,
Thanks.
yes, thanks for asking. So my direct line here at the registry is area code 319-335-7497, and my email is Michele, spelled Michele, -west @uiowa.edu.
Michele, this is Rachel from the Consortium, and
Yeah.
I just had a question. If you wanted to find like cancer rates of like the Vietnamese population in Polk County or something, how would you go about finding that data? Like, what would be a good source to go to?
See, I think that's some of the data that's just
So specific.
Yeah, I mean, if you know, with SearStat, I might have the capabilities of getting some of that just in case data. Like they don't have the populations to go with it, but I could at least get a number if we just want a frequency.
Okay.
So it's probably something that you could call me up, and then we'd have to see if the number is big enough to release.
Okay.
Okay, so I've got mine up there in the chat box. Hopefully everybody can see it.
And I don't know if you want, it looks like two people wanted you to go over the BRFSS data. So we could do that, or if there are any other questions. I don't see any in the chat box, and I wasn't sure if anybody else had a question on the phone. And while you think about which one you want to do, Michele, I just want to let everybody know about the upcoming series, the rest of the capacity building series. The next one is Policy Systems Environmental Change in December, and then Radon in January, and you can register for all of those at the link that's up there. And then if everyone would be willing to fill out the evaluation, I'm going to email out in a few minutes about today's session. That will help us plan for the future. So I appreciate that, and I also appreciate Michele's time today going over all the data information with us. So Michele, do you want to try to do the BRFSS, or do you want to?
Yeah, it's up to you. Should I try to do it on mine, or do you guys want to bring it up on?
I can try to, I'm going to, looks like Kelly's typing a question and then.
Okay.
Oh, perfect. That's
do you want me to, why don't I, oh, okay. I have the website if you wanted, or.
Oh, you're, yes,
no, I mean, if you want to type it in.
All right, so, do you see Google?
Yep, and it's just www.idph. .state, .ia.us/BRFSS/.
Oh, forward. I'm gonna. Sorry, what was the /? You said
didn't work.
US / and then what was the next part of the?
After so .us / and then BRFSS, and then another /.
hope I did the right. Very close enough.
Yeah, and if not, I mean, if a person had a particular question, they just list the different publications from the last however many years. There's quite a few out there. And, if you check in the table of contents, is it not working?
Nope, can you guys see that now? Can you see it, Michelle?
I can't. I just see download and installation help from Adobe.
There we go. Okay. There we go. Is that better?
Okay. Yep. Okay. Woo.
There, I'll try to get it into the right format.
Okay. There we go.
So there's the reports that people could go to, but then if they go down to the CDC data online, is that an easier searchable tool?
I always just go to the most recent year.
Okay.
But I can just bring up if it'll.
You have to ask
Do I have
control.
to control?
Oh, hopefully the download thing is.
Well, and I was going to say, it might not be worth it since we're running out of time. But, I mean, if you just bring it up and stuff and look in the table of contents, it's got all of the particular risk factor information listed and stuff. And so it's pretty easy to just click then on the topic that you're interested in, and it'll just bring you to that section, and it'll give you just all of the tables and stuff and the way that they've looked at the information. When I showed you the fecal occult blood tests and stuff, it'll have, if it's breast cancer information that you were looking at, it would have the mammography data, how many people, over 40 or over 50 have had, a mammography in the last couple of years or have had clinical breast exam, that sort of thing. So it's pretty easy, I think, once you just play around with it and stuff. And then just look, my recommendation would be to look in the last couple of years worth, and you can see if there are topics that weren't covered in one year that maybe are in the year before and that sort of thing. And Don Shepard.
In general, the screening data is available in even years for cancer.
Oh, perfect, Don. Yeah. I was just going to tell them that you would be the person to contact if they have any questions. So you must have known I was going to, give them your name. But, yeah.
All right. Well,
okay.
I'm going to go back to the last screen and no other questions that we're at. And I think that is it. So anyone, if you want Michelle's contact information to contact her directly with questions, it's on the chat box. And again, if you want to download the PDF of today's presentation, it's at the bottom right-hand screen. You can click download file and get that. So I thank everybody for being on, and hopefully we'll see you in December at the Policy Systems Environmental Change webinar. Thank you again.
Yep. Thanks, Sarah. Okay.